Welcome to Measuring Best Practices for Workplace Safety, Health and Well-being, the Worksite Integrated Safety and Health Assessment. Thank you for joining us. My name is Yusra Benjeloun, Administrative Coordinator and Project Manager with the Work Wellness and Disability Prevention Institute, and I'll be moderating the webinar today. This webinar is made possible through the support of the Community Gaming Grant Program through the BC government, as well as donations and memberships to WWDPI. We thank our program partners, Canadian Council on Rehabilitation and Work, Education Advisory Committee, and speakers who contribute to this webinar series. While we're waiting for others to join us, I'll go over a few technical points for the webinar. You should be able to hear the presentation through your computer speakers or through the conference call line if you dialed in. Please use the question box to submit any issues you may be experiencing and to ask any questions you have related to the presentation. We will collect questions submitted throughout the presentation and follow the presentation with a Q&A based on the questions submitted. Following the webinar, any questions not answered in the allotted time will be answered and distributed after the event. The presentation will be recorded and posted for free on our website within a week, along with the slides. You will be emailed the direct links for all of these items when they're available. As I mentioned, my name is Yusra, and I'll be moderating the webinar and Q&A session. Our presenter today is Dr. Glorian Sorensen. Dr. Sorensen is a professor of social and behavioral sciences at the Harvard T.H. Chan School of Public Health and director of the Center for Community-Based Research at the Dana-Farber Cancer Institute. She also leads the Harvard Chan School Center for Work, Health and Well-being, a NIOSH Total Worker Health Center of Excellence. Her research focuses on integrated approaches to workers and worksite health and safety, and has included intervention studies across a range of industries: manufacturing, construction, healthcare, social services, and transportation, with the small and large worksites. She also has ongoing worksite tobacco control research in India. And now I will hand it over to you, Glorian.
Thank you very much, Yusa. I appreciate your introduction. Welcome to all of you who are on the webinar. I'm delighted to be here with you today. As Yusa said, we will allow time at the end for conversation and discussion. So we've purposefully left time for you for questions and discussion. So please be sure to send in to Yusa any questions that you might have as I'm going on. Hopefully we can make this a little bit more of a dialogue. I think that we're all here today because of a shared goal, and that goal is around protecting and promoting worker safety, health, and well-being. It's something that comes both from the research that we do within our Center for Work, Health, and Well-being, but also within our practice, and I'm sure that for many of you involved in research and practice, it's a common goal that we all are about. What we want to do today in this webinar are to follow the objectives that are listed here. So first of all, I'll be looking at pathways between working conditions to health and safety outcomes using the conceptual model that we developed within our center. Using that framework, we will look at some of the evidence within the work that we've been conducting and refer to the work of others as well. And then we'll be introducing some strategies for improving worker safety, health, and well-being using a management systems approach. The core of our work, of our conversation today, will also focus on measures of indicators of these best practices. So I wanted to give you first a real sense of what are the best practices that we're talking about, and then what are we doing to measure them, and why would we even want to measure them. So with that in mind, just wanted to start by giving you a few of the key takeaways so that you can kind of picture where we're going. We'll start by looking at the fact that really to improve health and safety outcomes for workers, we want to focus upstream, not on the downstream indicators, but on really what are some of the root causes that might underlie some of the outcomes that we see. And we see within our research that working conditions drive many safety and health outcomes, and that oftentimes the pathways are interconnected, and that by improving some working conditions, we can improve multiple health and safety outcomes. So it gives us a way then to optimize some of these outcomes. Measuring some of the core indicators of these working conditions can actually help us in terms of setting priorities, planning for future initiatives, and evaluating the potential impact of the efforts that we might have underway. So let's start first with some background to kind of give us a framework for some of this conversation. For many of us, we might think about this as a standard model for worksite health protection and promotion. Many organizations have each of these 4 different functions within their setting. For example, there may be departments or individuals who are really responsible for supporting healthier behaviors through the services that they provide or through the workplace environment. This might include health promotion efforts, it could be health screening, there might be some policies and practices aimed at building a health promoting environment. For example, tobacco control policies or having healthy foods in the cafeterias. Secondly, for many organizations, there are ways of preventing work-related illnesses and injuries that often sit within occupational safety and health or ergonomics. These may be ways of controlling workplace hazards, improving ergonomics, or providing training around safety and health. There's also 2 other buckets. Many times these sit within human resources, but it may be related to how can we reduce job strain or work-related stress. Are there ways that we can support work-family balance? And then how can we expand work-related resources and opportunities, whether we're thinking of Medicare, medical benefits, or sick leave, or job training, or even our benefits and wages. When we think about these are oftentimes somewhat siloed functions within many employer organizations. And there's a fair amount of separation in some of these parallel activities. And so as we begin to think about these, we might want to move from this usual kind of siloed approach, which focuses very much oftentimes on individual employees, and gradually move upstream to more of a systems approach, where we begin to see collaboration and coordination among some of these different functions within the organization. And beyond that, we also start to think about some of the upstream root causes that might contribute to poor outcomes. So that we're switching from thinking about individual employees and what we can do to change individual employee behavior, and we're beginning to think about more of a population approach, where we're thinking about the workplace culture and the broader underpinnings of working conditions within the organization. We oftentimes see that this moves as well from thinking about the individual employee engaged in specific activities, which oftentimes ends up attracting many of the employees who are maybe already doing some of those desired behaviors, like participating in fitness programs or healthy eating. And what we want to do instead is to really engage the larger employee organization. So as we think about that within our team here, we really think about the ways that work matters for health and safety. And then it may start by identifying some of these underlying root causes in the working conditions that people face on a day-to-day basis. Typically, when we think of working conditions from an occupational safety and health perspective, we start out by thinking about some of the physical working conditions that might include exposures to safety and health hazards. We additionally want to expand our thinking to think more broadly about the work organization as well as psychosocial factors. So within the work organization, we might consider something like work hours or the pace of work, whether or not there are adequate benefits or access to adequate resources to do one's job. At the psychosocial level, we might be thinking not of how do we address job stress from a sort of individual perspective of stress management, but looking at what are the underlying sources of stress that might be mitigated as we're beginning to tackle and improve some of these working conditions. that might include improvements in supervisor support or coworker norms that allow us to ultimately build this culture of health and safety. So let's just try to think about each of these categories as we think about one example of how an employee might actually respond to one demand, which is how do they actually go about mobilizing a patient. And the encouragement might be to mobilize that patient using a sling such as the one listed here. We know that this kind of patient mobilization is desired from the perspective of many patients, but it's also, we've seen in our own work and elsewhere that moving patients with mobilizing devices such as this actually can prevent worker injuries as well. So to think about that, we have to start by thinking about the physical environment. Is there the equipment available and in good working condition to actually consider being able to use this to move the patient? But it doesn't stop there with the physical availability of the right equipment. It may require thinking about the job demands that this worker is facing. Does he have enough time to actually use this equipment? Is the workplace pictured or set up in a way where the patient health comes first, and actually taking the time to use this equipment might actually be discouraged? We might also think about how his work is organized. Is there a plan of care that really encourages the use of equipment? Does he have the authority and the knowledge and skills to actually be able to utilize this equipment? And then finally, what's his psychosocial environment like? Do his supervisors and coworkers actually encourage him to use this equipment? If he feels the need to get some help in doing it, is that encouraged in terms of actually asking for that kind of help? So you can see that a decision to participate in a healthy and safe behavior like this ends up responding to multiple working conditions, as we see here. We've tried to situate this all in a conceptual framework that we've laid out here and published in some of our prior work. And you can see that on the right-hand side, we've listed some of our critical outcomes that we think about. Obviously, worker outcomes such as injury, illness, and well-being are really critical to what we're thinking about, but we also consider some enterprise outcomes such as productivity, work quality, maybe turnover or absence, or even healthcare costs. And we often think about the integrated policies, programs, and practices as, on the left-hand side, as being the central part of our intervention. And what you can see here is that in the middle of all this, we see working conditions, and that these policies and programs are really designed to improve first these working conditions that we've been talking about. And by improving these working conditions, we're looking at how that actually may result in improvements in both worker and enterprise outcomes. So these pathways through which our interventions operate are really critical as we think about how we might modify the work environment for these improvements in working conditions. So just to summarize, we're starting here by using organizational strategies like these policies and practices to ultimately influence working conditions in order to ultimately improve employee and employer outcomes along the way. So let me give you an example of how this might work. If we kind of work backwards from employee and employer outcomes, we might think about, what would we picture as being the working conditions that might actually contribute to those outcomes, and what might be the corresponding policies and practices that would be appropriate for improving those working conditions. As we think about this, you might think about examples for your own organization and picture some of the critical employer or employee outcomes that would be a priority for your own organization. But let's take one example here where we might say, one of the concerns that we've identified in this organization is the need to reduce hypertension, and there might be medical costs that are associated with that. So we might stop and say, well, what are some of the factors in our working conditions that might be associated with these outcomes? And we might say, well, geez, there might be some job strain going on that might be associated both with maybe high work demands as well as low job control. So what can we begin to then do to unpack ways of actually addressing some of the policies and practices that might influence that? We may, in an assessment of our working conditions, begin to see that work schedules might really matter for some improvements in job strain, or that providing a broader range of resources might allow for some modifications in this direction. So as we go on here, we'll see that our assessments are really geared toward how do we make to kind of identify each of these components along the way in order to ultimately make improvements in working conditions so that we can see these improvements in the outcomes we're looking for. We do all of this through what we think of as an integrated solution, which as you can see here is something we define as a management systems approach. So we're really looking at the full system of approaching worker safety, health, and well-being, which starts by providing, obviously, a safe work environment, which we know is absolutely essential to any beginnings in terms of building a culture of safety and health. We build then upon some of the traditional occupational safety and health or health protection approaches, as well as some of the existing health promotion efforts, but begin to start coordinating and linking what might have been traditionally separate policies, practices, and programs, thinking back to that first slide of the various siloed functions. In this way, we begin to aim to foster positive working conditions and actually improve some of these outcomes that we're looking at. Now, you'll notice that at the bottom of this slide, I've also put that there's a continuum of approaches, and what we observe as we're working with different employers is that there isn't like one magic way to start all of this. Most of the time, we're recommending that people start small and that they may develop an incremental approach to taking on this kind of integrated solution. So there may be different employers at various points in this kind of a continuum. This approach very much aligns with what the National Institute for Occupational Safety and Health here in the U.S. thinks about as a total worker health approach. We are one of 6 Centers for Excellence funded by the NIOSH Total Worker Health Initiative. They are looking at this as the policies, programs, and practices that integrate protection from work-related safety and health hazards with promotion of illness and injury prevention, which ultimately is aimed at advancing worker well-being. So NIOSH is an organization that has traditionally very much focused on physical hazards on the job. Increasingly, they have become concerned about the fact that for many workers, the major outcomes that they're looking at in terms of poor health indicators are not necessarily coming from some of those traditional health and safety outcomes, but are coming from other parts of the ways their jobs may actually impact their health through some of these organizational and psychosocial factors that can be such important contributors to some of the health outcomes. So this is really what NIOSH is saying, is they begin to look at this kind of integrated approach of taking an approach to traditional physical occupational hazards and bringing in some of these other workplace contributors to poor health outcomes. So let's maybe kind of pivot here and actually take a look at some of the evidence. But before I get into the evidence, I just want to stop and tell you a little story. I first started to think about some of these issues of how we might want to think about the work environment many years ago when I was doing some of my first work within Worksite Health, and I was actually doing a tobacco control program. And one of the participating work sites was actually a foundry, illustrated here in this old picture. And one of the workers came up to me and said, "Why should I quit smoking? I'm just exposed to all these fumes every day. It really doesn't matter if I quit smoking." And that was a real indicator to me that from the perspective of workers, particularly workers who are exposed to hazards on a day-to-day basis, what matters to them is the way that their working conditions intersect with their health outcomes. They're aware of the fact that their work matters for their health. And as we begin to think about bringing in a program like a smoking cessation program, if we don't think about those broader working conditions, we're going to miss out on some of the core messages that workers need to hear about. So we began with that in mind with some of our early work, and this is an older study that I present primarily to just give you a little sense of where we've come from. We began here by testing this hypothesis that the integration of health protection with health promotion would actually enhance the impact of the intervention on behavior change over and above just looking at health promotion alone. This was a large-scale cluster randomized trial. We worked in 15 manufacturing work sites, which were randomized to one of two intervention conditions. So all of the work sites got something, and they actually got a standardized amount of the intervention. It was just that the focal point of the intervention was different. On the one hand, we focused on a health promotion only group, and on the other, we focused on bringing into that an occupational safety and health intervention that actually changed the basic underlying assumptions of the program. So that, for example, when we provided a tobacco use cessation program, we didn't just focus on tobacco use, we also talked about the intersection of tobacco exposures with some of the hazardous chemicals that workers might be working with. Or when we came into to work with management on changes in the work environment, we talked about this broader array of work environment changes that would be supportive of worker health outcomes, not only in terms of tobacco use or nutrition, but also in terms of their potential exposures on the job. This was a 16-month intervention where we conducted baseline assessments and then followed up with assessments at the end. I'm not going to present all of the findings, but I'd like to show you here our adjusted 6-month smoking cessation rates, which are presented here by job type. Hourly workers are those workers that in this study we think of as the blue-collar workers. Blue-collar workers who are more likely to be exposed to hazards on the job and are less likely in general to quit smoking compared to their managerial counterparts, the salaried workers. What we saw here is that the difference between the integrated intervention and the health promotion intervention for salaried or managerial workers was not statistically significant. Although it looks like the health promotion only is a little bit higher, this is not really a statistically significant difference. But overall, you can see that the quit rate in this group is higher than what it would have been for the health promotion only group for hourly workers. What we see is a doubling of the quit rate among hourly workers who participated in the integrated intervention, and that quit rate is actually comparable to the quit rate that we see in salaried workers, where the quit rate is usually much higher. So this really illustrates the significant impact of this integrated approach for those workers who were exposed to hazards on the job, represented here in these hourly workers. This has implications, particularly for those workers who are exposed to hazards on the job, as you can see in this first bullet. We also saw higher participation rates, both for workers and managers, which really illustrates that, by bringing in the broad array of these issues, we may actually have a greater penetration of our messages within some of these organizations. We also saw, although we didn't have a large enough sample size in terms of the number of work sites to look at change at the worksite level in the use of chemicals or potential for occupational exposures, we did see improvements in occupational health programming and promising directions in terms of the impact on exposure reduction. So we saw these as very critical and promising findings for some of the research that we were doing. And we've continued this in different ways in our current work. The Boston Hospital Workers' Health Study is a collaboration ongoing right now with Partners Healthcare and our Center for Work Health and Wellbeing. It includes an array of data that is illustrated even a little bit more here, where we've actually developed an integrated research database where workers are clustered in patient care units. And we have data that comes from surveys of workers as well as their supervisors. We have data from them related to hospital injury incidents or worker compensation data. We have absence data. And we additionally have utilization of healthcare and spending based on some of the insurance data that the hospital has actually provided to us. This data set has been an enormously rich resource in terms of beginning to understand some of the ways in which these working conditions really matter for worker outcomes. And what this particular slide illustrates is a way of sort of taking that earlier figure with our conceptual framework and illustrating some of the specific conditions of work that we've actually shown to be related to some of the worker proximal outcomes as well as longer term outcomes such as pain and work interference. So you can see here that issues like job demands or job flexibility, the level of staffing or shift control, and issues like support from one's coworkers and supervisors really matters in terms of the outcomes that we see and the intersection in some of these shared pathways within the conditions of work. Let me break this down a little bit further for you with a couple of specific examples. First of all, this slide comes from several papers where we showed how some of our conditions of work that we've studied, supervisor support and bullying at work, relate in a similar way to a range of different health and safety outcomes, so that risk of injury is actually related to, is reduced with improved supervisor support, but actually increases with bullying at work. Or conversely, physical activity rates actually improve with supervisor support and decrease with bullying at work. And we see similar trends with sleep deficiency. Part of the message here is that as we begin to make improvements in the culture of work, in these conditions of work that we're looking at, we begin to see the potential for impacting not just singular health and safety outcomes, but multiple outcomes simultaneously. I'd like to just walk through a couple of results for you on some of these with some specifics, with a couple of specific examples. The first one looks at workplace bullying and mental health expenditures and specifically addresses this question: do bullied workers have greater health plan expenditures on mental health diagnoses compared to non-bullied workers? So what we're trying to do here is to capture both the healthcare costs to workers as well as the economic cost to employers. And what we see, we looked at 3 different types of bullying, which are listed under the types at the bottom of the slide: being ignored or excluded, being humiliated and ridiculed, and withholding information that would allow one to be able to do one's job. And you can see that with increasing types of bullying, there is increasing costs over a 2-year period in terms of mental health care claims. This is an important example of how experiences of workers on the job can really spill over into their own health as well as have real meaning for employers. Secondly, I'd like to illustrate for you a little evaluation that we did of one of the programs in one of the one of the hospitals, and this one particular hospital actually implemented a hospital-wide safe patient handling program that was actually part of a patient mobilization initiative, a little bit like the first slide that I showed you with the patient movement example. We compared the results here with another hospital, a very similar hospital, but a hospital that did not make a similar type of program. This analysis relies on our survey data as well as our injury database and our understanding of how this policy was actually implemented. And as we looked at it, this was implemented following some of the core components of what we think of as an integrated approach. First of all, there was strong leadership commitment for this program, illustrated through an internal marketing campaign as well as through communication of the commitment from management to make sure that this would actually be put into place effectively. It was also a comprehensive and collaborative effort that was managed by multiple departments through a coordinating committee and a departmental infrastructure that really encouraged this kind of collaboration across different departments. And it addressed multiple working conditions, as we saw in our model. So there were lifts that were in every room. The laundry and maintenance departments were involved in making sure that the slings, for example, were available. The work organization saw to it that there was an integrated patient care plan that incorporated one-on-one training of patient care providers. And the training of nurse directors really provided support and mentoring for the institution of these kinds of efforts. What we saw was not just the implementation of the policy, but that actually there was a significant increase in the use of this equipment and a significant reduction in lifting injuries that might be associated with lack of this kind of an approach of patient mobilization. So across some of these studies, we've drawn a few conclusions. We see that these health and safety outcomes share common root causes in the working conditions that we've illustrated here, and that these working conditions really matter both for health and safety of workers as well as for enterprise outcomes. So as we've tried to illustrate from this last little example, a systems approach can really contribute to improved worker safety and health. So we're not the only ones who are studying this. There's a growing body of evidence across the total worker health centers that is looking at this. And I've illustrated here a couple of additional resources for you. The John Quelch book on building a culture of health is fairly recent and is a really good example by a former faculty member at the Harvard Business School of ways to really think about this in a broad way. Also, our collaborator, Ray Fabius, has done some really interesting work that has illustrated that financial performance of companies may actually be associated with having this rather integrated systems level approach to thinking about health and safety. He took samples of really looking at the financial performance of employers or companies that were actually dedicated to ensuring the health and safety of their workers in this integrated framework, and actually found that they performed better financially. So I would encourage you to take a look at that really interesting article. You can see here as well that there's a growing evidence base that this approach is related as well to productivity and worker satisfaction, improved participation and behavior change, as well as reductions in absence, turnover, and other related issues. So we're delighted to be part of this area of exploring this research. So this has brought us to thinking a little bit about, well, how do we know when a company is actually using this kind of an integrated approach? What are the measures that might actually be out there to tell us whether this integrated approach might actually be happening? So to actually look at that, we began by actually saying, well, what are the sort of core indicators or key characteristics of this integrated approach? And we identified the 6 key characteristics that are listed here. And I'm going to go over each of these with you to illustrate how we've measured each of these. So I'll provide some definitions in a moment. What we did was really, in thinking about this, we said, you know, what would be the advantages of having a systematic way of assessing these integrated approaches? And we found from our own experience that it could really be useful in informing priority setting and decision making for employers. That having a tool that provided feedback in terms of where are the gaps, where are things going well, what are some of the potential innovations in terms of how an employer might begin to tackle this approach or maybe improve health and safety by looking at kind of a standard tool that provides this kind of feedback. That can be a way of really informing some of these efforts. This kind of a measure can also allow us to track improvements in working conditions over time, so that as we begin to make changes within a work organization, we can see what kinds of improvements have actually been successful, and also begin to look at the impact of those kinds of changes, both for worker safety and health, as well as for enterprise outcomes. Ultimately, the use of these kinds of approaches can be very helpful, not only in guiding our research, but hopefully as well in ultimately informing policy decisions. So we felt that this was an important strategy, a rationale for actually engaging in this kind of initiative. So we developed what we call the Workplace Integrated Safety and Health Assessment, the WISH tool, which is a questionnaire that's measuring these 6 key characteristics that we as a team here identified as central to best practices for protecting and promoting worker safety, health, and well-being. We did this in a systematic way. First of all, before I get to the way we did it, this is what it looks like. It's available on our website listed here, and also in our publication from last May in JOEM. And to develop this, we started out by a very thorough review of the literature to really help us identify some of the core constructs that we thought were really critical. We had a broader list initially than the 6 that are listed, that I listed for you. But as we worked with kind of this iterative modified Delphi process, we engaged experts in really working with us from a multidisciplinary perspective to help us hone in on what we saw as the core constructs that should be a part of this. We then began another literature review to look at what measures would already be out there in the field, and to the extent possible to use the measures that were already available. We then combined these and did some systematic cognitive testing where we actually asked employers and HR directors and other people in the field to complete the survey for us, and then walk through with us how they understood each of the questions and how we might improve the questions so that they would be better understood and more consistently understood. So let me go over those 6 characteristics with you. As I mentioned, we saw leadership commitment as really core and central to the implementation of this integrated approach. And by that, we really were considering that the organization's leadership is really necessary in terms of making health and safety an organizational priority, driving accountability across the organization to ensure that this happens, allocating resources to make it happen, and really ultimately creating an environment for positive working conditions. So you can see that we had 6 items to measure this. I'm not going to go over each of the 6 items, but this is one sample. Our company leadership, such as senior leaders and managers, takes responsibility for ensuring a safe and healthy work environment. So you can see that the items that we developed in response to the definition were really designed to capture one component of what we saw as part of our meaning within the leadership commitment. Second, we looked at participation, which we saw as stakeholders at every level of the organization would help plan and carry out efforts to protect and promote worker safety and health. And so, for example, this might be measured with something here, such as in this organization, managers across all levels consistently seek employee involvement and feedback in decision making. We had 5 items here with this part of the index. A core part of our index, as you can tell from our conceptual model, we place a lot of emphasis on working conditions and that employers actually have policies, practices, programs in place that would really foster positive working conditions. And we saw that as a critical component that warranted actually the most items in the scale, 14 items included here. For example, this organization ensures policies that prevent harm to employees from abuse or harassment, or that the organization takes protective measures to ensure that the workload is reasonable. We tried within this to think about some of the core priorities for positive working conditions and sought to measure them through the items that we included. We also had a piece that was on comprehensive and collaborative strategies measured by 6 items that really gets at this idea that employees from across different departments within the organization would be working together to develop comprehensive initiatives in a shared way, so that you can see with this item, the company coordinates policies, programs, and practices across departments. As we see the potential impact is strengthened through this kind of coordination. By adherence, we meant that the organization actually adheres to federal and state regulations as well as ethical norms that would advance worker safety, health, and well-being. So this related not only to the example here in this sample item of complying with regulations about minimizing or eliminating exposures to hazards on the job, but also to really thinking about some of these issues related to ethics, privacy, confidentiality, and related issues. And then finally, we defined data-driven change as regular evaluation that guides an organization's priority setting, decision-making, and continuous improvement. So we could illustrate that here with this sample item around data from multiple sources within the organization would be integrated and presented to leadership on a regular basis. So these are how we've assessed our 6 core items. This is still a work in progress, although we've made our measure available on our website, and we definitely encourage organizations to use it, take it, and make sense of it. We are continuing to do research on it. We're using it right now in multiple settings, including in long-term care, healthcare, and food service. We'll be validating the instrument against some comparison measures, and we're working still on the best approaches to scoring the measures, probably considering a way of actually having a measure for each of the subconstructs within the scale rather than summing across them, thereby giving some appropriate weighting for each of the subconstructs within the scale. We are eager to hear from others who might be using this measure, so if you or others you know of would like to use it, please feel free, but also let us know how it goes as you might actually be using it. So that brings us finally to some resources for practice. We hope that the WISH tool is actually something that is used not only in research, but also in practice in terms of guiding the decision-making that employers are putting into place around this integrated approach. We have pulled this from a set of guidelines that our center has developed, also available on our website for free, that includes focusing on these different components like leadership, collaboration, and evaluation as some of the core measures. And we've really aligned many of the messages within the guidebook here with some of the core constructs in the WISH tool. I would refer you as well to other resources within our Center for Work Health and Wellbeing. Please follow us on Twitter. And I'd like to put in a plug for my colleague, Deborah McClellan, who will be giving a similar webinar in a couple of weeks on Tuesday, April 9th. And so she will actually be taking this model and actually talking about how you might be able to weave this approach into the fabric of your organization, building on the tools presented in our guidelines, and really taking my presentation here today the next step further in terms of thinking about how one might actually implement these guidelines. So in conclusion, I'd like to leave you with a few considerations for organizations. We think within our center and the work that we've done that improving working conditions can really add value, both for employee health and safety as well as the bottom line. And that a systems approach can really be a mechanism for building a sustainable culture of health. To do this, we encourage organizations to really start with aligning this approach with your own business priorities and the way that you already get things done by looking at your own root causes that might be contributing to some of the priority outcomes that you might identify through assessments within your organization. But within that, building success in very small steps, not necessarily trying to take on everything at once. And we hope that in thinking about this, you will consider using our WISH instrument or looking at other ways to measure along the way in order to assist with planning, priority setting, and determining progress as you move along. So with that, I'd like to thank you for participating. This is a group of us here in the Center for Work Health and Wellbeing. I've included my email address and certainly a core recognition of our funders at the National Institute for Occupational Safety and Health. And please feel free to take a look at us on our website or follow us on Twitter. So I will stop there, and Yusra, I will turn it over to you for questions and conversation.
Thank you so much, Glorian, for this great presentation. So immediately we'll start our Q&A session. To our audience, please insert your question in the question box if you haven't already. So the first question, this is a recurrent question actually that comes in our webinars usually. So you mentioned there's no magical way or formula for strategies that are the most effective, but in your opinion, what are the success components that interventions must incorporate?
Oh, that's a good question. And I think that what we've tried to capture in the 6 components of the WISH instrument are what we think of as the core components. So it includes this idea of leadership commitments behind it. It includes the participation of diverse stakeholders within the organization. This focus on policies, programs, and practices that can really foster positive working conditions, comprehensive and collaborative approach through considering as well the issues of adherence and data-driven change. Those are for us some of the starting points. We picture the starting points as varying a little bit from one organization to the next. And when Deborah presents in a couple of weeks, she'll be digging in a little bit more deeply into the planning and prioritizing process. I hope that answers your question.
Perfectly, thank you so much. Another question. So I'm sure many employers with sometimes limited resources want to improve workers' health and productivity and don't quite know where to start. So given your experience, how would you advise them as in where to begin and what to look at and focus on?
Well, in our experience, the answer to that is really very specific to each organization, and it starts by actually looking at what are some of the driving concerns, what are the pain points within a given organization that shape sort of where to start. That determination can come from conversations with employees, with line managers, or others within the organization to really begin to look at defining those core priorities. And then we really encourage this idea of worker participation in really trying to think about what might be approaches. Not that we're saying workers, I think workers can have a huge impact in terms of helping us understand what strategies might really make a difference, and that in dialogue with management, they can really help to set some of those priorities while also understanding some of the resource constraints that might really place limitations on the strategies that might be used. I would say also that not everything requires huge investments of large resources. So, for example, we are working right now with a large food service employer around 3 different working conditions that have been identified jointly with them around priorities that make a difference for worker health and safety. One of them is sort of ergonomics and safety, the second is work intensity, and the third is job enrichment. And as we've looked at, for example, ergonomics, we've seen through walkthroughs that we've done that a major contributor that can be easily addressed is simply addressing clutter within the organization. It's not like a huge, costly venture, but simple housekeeping measures can actually make a huge difference in reducing the potential for reducing injuries incidents. Just as one example. So we're trying to think about how we can coordinate with employers on how do we identify the outcomes, and how can we think about potential solutions that are not necessarily always driven by cost.
Thank you so much, Glorian, for your explanation. The following question is, with some mixed leadership understanding, proactive health designs are put after business priorities. So what are some best approaches to address this challenge and gain leadership understanding and support?
So was the question really how do you gain leadership support and commitment? Is that what you're saying?
Leadership understanding and support, yes.
Okay.
Yes.
Yeah, I think that's a really good question, and we recognize that oftentimes some of the efforts for these issues are championed by others within the organization, not necessarily by leadership. I think that what we would recommend is trying to figure out if there are strategies to link this to existing core priorities within the organization, or core ways that things get done. So let me give you a couple of examples of how we have tried to do that within some of our own collaborations. Within healthcare industries, we've really seen that a core priority for many healthcare in many healthcare settings is patient care and quality of patient care. And what we've seen is that to the extent that we are able to link some of the health and safety outcomes to patient care outcomes, such as the example I gave here around patient mobilization, we can align some of the efforts to improve worker safety and health with business priorities that are core for the company. In a similar way, in construction, we have seen that the way that operations are often organized are by central work planning mechanisms, whereby the work plans get instituted on a day-by-day or week-by-week basis, and that if we can begin to insert safety and health operations into that work planning process, it becomes a way of contributing to the achievement of the business objectives while similarly putting health and safety on the map. So I think one starting point may be to think about, what matters to the employer, what is leadership's concerns, and how can those concerns and priorities be aligned with some of the core concerns around worker safety and health.
Perfect. Thank you so much. Our next question is, how might this model be taken into a health plan that works with multiple different construction organizations?
We are currently working with a health plan in Minnesota, Health Partners, which provides kind of vending services to a range of different employers. And what we are trying to do is to work with Health Partners in training providers of occupational health and safety services, as well as more health promotion, health behavior kind of approaches, and to begin to train them up in a collaborative, coordinated way where they may both understand kind of how this integrated approach may work, and how they may begin to incorporate this integrated approach into the kind of consulting services that they already provide. I'm not sure within the health plan that you're talking about, how things are organized and structured, and I'm not sure if this gets at your question, but I think that vendors can really play a critical role in guiding employers to think about this integrated approach and beginning to provide resources in how to make it happen.
Our last question, and I believe you've mentioned a little bit of it on your next step slides. And so what needs to be done in the future regarding research and the implementation of effective programs? In your opinion, what are the areas that are neglected related to worker health and safety and improvements?
Oh, that's a great question. Thank you. I appreciate that.
Yeah, of course.
I think that I tried to give you next steps in terms of how we're thinking about it for our WISH assessment. But I think that we are really trying to struggle with, and I believe that we as a community of public health professionals need to provide the evidence base that we can to really make a business case for these approaches, to really illustrate to employers that it's feasible to make these organizational changes, and that making these changes in policies, programs, and practices to improve working conditions can really matter and be successfully and feasibly implemented while also really having benefits for the broader organization. I think that our research can really make a difference in that direction, and I think it can be a shared goal for all of us who are working in this area.
And we concluded with our last question. Thank you so much. Would you like to add anything, Glorian, before we end the webinar?
These are great questions. I really enjoyed it, and I would love to hear from any of you. If you have further questions, please feel free to send me an email or to link up with us on our website. But I really appreciate the opportunity to be with you here today.
Thank you. Thank you so much for bringing us closer to ways to contribute to noticeable improvements in health outcomes for workers, and providing us with effective guidelines on how to build organizational capacity for safety and health approaches. Thank you so much, Glorian. And to our audience, thank you. And to our audience, we're grateful that you're able to join us.